a talented student, actually, Eugénia Nogueira from Braga, with her talk, Folate Targeted Nanoparticles for Rheumatoid Arthritis Therapy. Thank you.
Good morning to you all. First of all, I would like to thank the invitation of CLINAM to be present in such a representative conference about clinical nanomedicine, and of course to take the opportunity to speak to all of you a little about folate target nanoparticles for rheumatoid arthritis therapy. After the very interesting presentation of Dr. Stephanie Stanford, all of you already know that rheumatoid arthritis is the third most common inflammatory rheumatic disease. This autoimmune disease is characterized by inflammation of joints, resulting in synovial hyperplasia by infiltration of immune cells, further leading to cartilage and bone destruction. Also, the cause of rheumatoid arthritis remain unknown. Several pathways have been recognized as important in their development. The complex interaction between cytokines and immune cells is responsible for the joint inflammation, then starts at synovial membrane and can affect other structures. As many other diseases, rheumatoid arthritis is a combination of genetic and environmental factors that, when present, increase the susceptibility to develop clinical manifestations. Multiple loci have been identified as important in development of rheumatoid arthritis, behind the human leukocyte antigen locus the most important. However, this higher risk is just present in patients with positive rheumatoid factor, an antibody directed to the Fc region of hemoglobin G, and anti-citrulinated proteins antibodies, the ACPA. The ACPA recognizes the non-classic amino acid citrulline present in protein sequence. Citrulline is produced by a post-translational modification of arginine mediated by an enzymatic process, and this reaction happens in several processes in the body, including inflammation. However, which some of you may do not know, is macrophages have a central importance in the pathogenesis of rheumatoid arthritis. They produce cytokines in which in turn promote inflammation by recruitment of additional immune cells. If left untreated, such inflammation can progress for joint destruction and joint disability, especially in hands and feet. Rheumatoid arthritis therapy, while directed to decreasing joint inflammation and joint destruction, have undesirable side effects. Due to their importance, the specific neutralization of macrophage activation is an appealing approach. Several therapies have been designed to eliminate their entire population of macrophages, but due to their higher importance in so many processes in the body, this can cause severe side effects. The specific neutralization of a subpopulation of chronic activated macrophages is an alternative. Activated macrophages have been shown express specifically the receptor for the vitamin folic acid. There are several isoforms of this receptor being expressed mainly in cancer cells, alpha isoform, and activated macrophages, beta isoform. The folate receptor allows internalization of folated coupled cargo by a folate receptor-mediated endocytosis. After acidification of endosomal compartment, a conformational change in the protein folate receptor allows the release of folate-bound ligand and its delivery in cytosol. In this presentation, I will exploit the potential of folate target nanoparticles as a drug delivery system to specifically target activated macrophages and reduce long-term effects of rheumatoid arthritis. Methotrexate is the first-line therapy in patients with rheumatoid arthritis, according to the treatment recommendations of European League Against Rheumatism present in this algorithm. However, some side effects have been associated, and when the patients do not respond to methotrexate or become intolerant, biological agents should be used. The problem is that biological agents are 20 to 200 times more expensive. So it's important at least increase the tolerance of patients to methotrexate and delay the introduction of biological agents in the therapy. In this way, the development of folate target nanoparticles encapsulating methotrexate to improve the rheumatoid arthritis therapy and decrease side effects of methotrexate is imperative. In the last years, some studies report the development of folate target nanoparticles for directly target activated macrophages and improve the clinical benefits of methotrexate in arthritic mice. Thomas and colleagues in 2011 described the development of folate conjugated dendrimers. Also, dendrimers have been studied as drug delivery systems, some concerns remaining regarding their safety for therapeutic use. In particular, therapeutic agents are at the surface, and they are not protected from degradation prior to reach the target site in vivo. Additionally, the limited number of molecules of ligands and therapeutic agents conjugated to the amino groups at the surface. Furthermore, higher generation of permanent dendrimers exhibit toxicity due to their high cationic charge density. And finally, the produced dendrimers are now stealth, and it was known that unmodified nanoparticles do not survive long in circulation, but instead are removed for macrophages of mononuclear phagocytic system. More recently, we described the encapsulation of methotrexate in a new liposomal formulation with a hydrophobic peptide from the surfactant protein sequence linked to folate. Behind the unique characteristics of liposomes of being both non-toxic and biodegradable and protect the encapsulated drug from degradation, our liposomes are stealth due to the presence of polyethylenoglycol. The modification of liposomal surface with polyethylenoglycol clearly increase the circulation lifetime of the liposomes. Our results show that the concentration of polyethylenoglycol is very important. We verified that 5% is not enough to improve a stealth degree in liposomes, and liposomes with or without folic acid are similarly internalized. And only 10% is enough to improve the stealth degree, reducing the non-specific uptake of non-target liposomes and promoting the specificity of folate-mediated targeting. This result is in good agreement with the current scale model of polymers at interface that predicts a mushroom brush transition in PEG conformation at 5%, where PEG coils start to repel with each other and extend out from the surface where they are grafted. To test the specificity of liposomal formulation in a pathological context, arthritis were induced in mice. Comparatively with non-target liposomes, folate target liposomes strongly accumulate in the bones of arthritic mice. The fluorescence analysis of the ankles of two groups clearly show a higher internalization of folate target liposomes. And finally, to prove the ability of liposomal formulation as a drug delivery system, liposomes encapsulating methotrexate were administered in mice before disease onset. A complete prophylactic efficacy was observed in mice treated with folate liposomes encapsulating methotrexate, where mice did not show any clinical signal of the arthritis. Comparatively, where the drug was injected in a soluble form had only a marginal effect and did not prevent for development of arthritis. These good results obtained in the previous Nanofall European project allows the funding of a new project to advance with preclinical development and phase 1 clinical trials. The new project named FallSmart is also funded by European Union under the Horizon 2020 program. And to finish, I would like to present you the people involved in this work. Besides the research group at the University of Minho, headed by Professor Artur Cavaco Paulo, I would like to thank the key contributions of Nanofall and FallSmart partners, and last but not least, the several grant provided by Arthritis National Research Foundation that allows me to be present here today. Thank you.
Thank you. Questions?
Thank you. What is the molecular weight of the polyethylene glycol that you use? And then there are some studies that in the case of Doxil, where a 2 kilodalton PEG has been used, they demonstrate that the 5% PEG is the optimum, because if you increase the percentage of PEG up to, for example, to 10%, you tend to destabilize the liposome due to the formation of micelles of only PEG. I wonder if you see some similar effects or formation of micelles with the
no, at this moment we not study this behavior. The molecular weight is 2000, yes.
More question? Actually, I have a question. Did you investigate the biocorona of those particles, like both like systemically and locally, like immediately after the injection, like in vitro, in vivo, and in vivo, systemically and also in the joint?
No, we do not observe that, but further studies will be performed, yes.
It would be recommendable, because there is not really clear, I would discuss it with Professor Fadil about that, he's an expert, that pegylated nanoparticles, not really clear why increasing the density of the PEG chains, they acquire this stealth behavior. If they really block the opsonization, but it looks like nowadays they don't block the opsonization process. So it would be pretty interesting to correlate the ability to enter the joints after the systemic injection with the particular type of protein corona that they have.
Yes, it will be interesting. Thank you.
Of course.
If I may just add a comment to this, I think it's an interesting question whether for all types of targeted nanomedicines, whether the corona will mask the targeting ligand or have some impact. We published a paper a few years ago where we used folate functionalized nanoparticles to target ovarian cancer cells, and contrary to other literature at that time, we found that in the presence of serum, the targeting was enhanced. So we didn't see masking of the ligand. This may, I should say, in the presence of 10% serum in the cell culture. So these were in vitro studies. But so while the excessive amount of serum may mask the targeting ligand, we instead reasoned that the presence of serum stabilized the particles and allowed for a de-agglomeration of the particles and a better presentation of the targeting ligand. But your question is interesting, because there might be one corona in the bloodstream and another corona in the synovial cavity. And so I would tend to agree with with you, that Massimo, that this is an interesting subject to study further, also with your nanomedicines.
Thank you for your appointment.
More questions? Thank you,
Thank
Eugénia.
you.